I'd like to talk about my quadruple bypass open heart surgery. And if someone else is about to have a CABG, maybe they'll find this helpful because I'm going to talk about it from my personal perspective. First time a nurse asked me if I'd had a CABG, I thought she was joking. I'd never heard of that term before, but CABG stands for, it's CABG, and it stands for coronary artery bypass graft. There are other procedures besides the one that I had. Mine was the conventional open your chest and take some veins from your legs and graft them onto your heart. There are some minimally invasive ones now, so what I'm about to say really doesn't apply to those people that have a different type of surgery. And this is from my memory, my perspective, and I was heavily sedated at times, so my memory may be a little bit distorted, but I'll do the best I can. In May of 2008, I had a heart attack and went to the emergency room. And in the emergency room, they discovered a cantaloupe-sized tumor in my chest that was engulfing my heart and trachea and esophagus. Now, it's hard to imagine that you could have a tumor that size and not even realize it, but I didn't know it. So they knew I had some blockages, and they knew I'd had a heart attack, so we did a angioplasty to put in some stents, but unfortunately, when they got in, they go in at the top of your leg through your femoral artery and go up into the heart, and they intend to put stents in there to open up those arteries that are feeding your heart, but mine were too blocked and they couldn't do anything with it. So they scheduled open heart surgery a couple days later. Now, my surgery was complicated a bit by the fact that I had this tumor, and the surgeon had to cut away chunks of the tumor in order to get to my heart. And he said it was like a hard rubber ball, very fibrous and tough to cut through, so it made his job a little more difficult. I had a quadruple bypass, and they start off by giving you an IV with some sedative, and you feel pretty good. And they wheel you down to the prep room. I really don't remember anything about the prep. They put in a catheter, and they got me ready for the surgery, but I don't remember any of that. From my perspective, it seems like I fell asleep and woke up 10 seconds later, and I was in the recovery room. I didn't know what was going on. I was totally paralyzed. I had a breathing tube down my throat. I didn't feel like I was breathing, but obviously I was, because I was still living. And I wasn't gasping for breath or anything. It just was, it was just there. It was just taken care of for me. I really wasn't in any pain, but I could not move. I couldn't talk, couldn't make any sound. And the strange things that go through your mind. I thought, they haven't done the surgery yet, and I've woken up, and here I am going to have surgery, and I'm totally awake and will feel it and all. And, I could have panicked, but I remember before I went into the surgery, a nurse gave me some really good advice, and it seemed so simple at the time. She said, when you wake up and you're on a ventilator, breathing tube down your throat, you'll want to panic. But don't panic, because everything's under control, and just relax and take it easy. Well, it was really good advice, and everybody didn't get that advice, because as I became more aware of my surroundings, I realized that there were people around me in recovery that were panicking, and you can make it a lot easier on yourself by just stay calm. You're not hurting. They've got everything under control. So it seemed like just a few minutes, feeling came back. I started to be able to move a little bit, and eventually they took me to intensive care unit, and I had to spend a couple of days there because I had a problem with AFib, atrial fibrillation, where your heart quivers and it's not pumping properly. That's not uncommon after open heart surgery, so nobody got too excited, but they did keep me in ICU a little bit longer. So when I got back to my regular room and started my recovery, they gave me a pillow, And that pillow becomes your very best buddy, because when you cough or sneeze, that incision, which runs from about right here, I hope you can see that, up to about right there, it kind of hooks to my right a little bit at the top. I don't know why, but that incision can be painful when you cough or sneeze. Not unbearably so, but it's not comfortable. So you hug that pillow as you cough or sneeze, and it makes it a lot easier. And so you tend to hug that pillow a whole lot. You don't let it out of your sight for several weeks. That pillow was donated by an organization, and it really does help. They take out the breathing tube in the recovery area. They took mine out in the recovery area, and they put me on an oxygen mask, and I came off of that when I came out of ICU. It was still available if I needed it, but I didn't really feel like I needed it, even though I did have some problems breathing after the surgery, but not bad. After recovery, and they gave me my pillow, of course you examine your scar, and you're concerned about everything and your breathing and all of that, but over the next few days you're feeling so much better. And even when I had the scar, I mean, even when I had the incision that wasn't healed, I still felt better. I was, no pains, no angina. You're feeling pretty good. So after a few days, I went home. I didn't really have many restrictions, just a few restrictions against lifting. I didn't get to go to rehab, because instead of rehab, I went to chemotherapy and radiation. And so for the next 5 months, I did chemotherapy, and then I did 20 sessions of radiation after that. And I started cardiac rehab about a year after my actual surgery. So I had to pay for it myself, because the insurance wouldn't cover it that far out. So I'm still doing rehab to this day. 5 years from my surgery, 4 years starting rehab, and I feel like it's really, really worthwhile. Mentally and physically, it does so much for you that I plan to just continue with it. I don't have any restrictions now. I feel great now. I did go through something I'll talk about, but now I'm feeling wonderful. I do anything that I want to. It's very worthwhile. But let me just say that it's natural to worry about your CABG, but they do thousands and thousands of these, and they've gotten the procedure down so pat, you'll breeze right through it. And the less you can worry about it, the better. I know it's easy for me to say, but look at it as an adventure. You're going to meet some wonderful people, and it's going to be a great learning experience for you. Maybe one you'd rather not have, but still, it will be. And afterward, you'll belong to the club of CABGs and be one of us. So, about 2012, just a little over a year ago, I started having some more angina. And I became very concerned about it. My doctor's appointment, my cardiologist appointment, was still a few weeks away. And I read a couple of books, Dr. Dean Ornish's book on reversing heart disease, and Dr. Caldwell Esselstyn's book on preventing and reversing heart disease. And I became convinced that a vegan lifestyle would help me. So I went on a strict vegan diet last July of 2012. And within 3 weeks of going on that diet, my angina disappeared. Now, I'm not saying that that's going to work for everybody. I don't know. Maybe it does. These doctors seem to think it works for at least most people. But I really enjoy this diet, and it's been so helpful to me. You can look at some of my other videos and see what the results have been. But this diet has been fabulous for me, and I strongly recommend that everybody look at healthier diets. And I personally believe in going 100% vegan and whole food, low fat vegan at that. But I think anything in that direction is beneficial. So I just wanted to pass that on to you, and I'll say best of luck to you in your surgery. I know everything's going to be just fine, and you'll be so glad to have it behind you, and you'll feel so much better. I thank you for watching. Until the next time, cheers.